Hey guys, welcome to Podiatry Practice Mastery. Don here. I want to do a deep dive today into something called Patient Education Genius. So I want to tell you a little bit about the background here. I've always been a big advocate of sharing information, and in the past I used to do it with like patient handouts and brochures and all these other things. But as media has changed, there's different ways of sharing things. So I want to share some of the problems that I had, some of the mistakes I made, and kind of tell you about some things that are going well. So in the past, when I first started, my first patient education thing was this. It was a diabetes toolkit, and it was a little, almost like a pencil holder. Remember those zipper pencil holder things you used to make? I put in there a little diabetes foot book. I put in there I put like a little mirror and a couple of handouts and some biofreeze and some stuff like that. Anyway, yeah, that was a flop. And then I wanted to make a diabetes foot book. And so I made that book, and I dictated it, and I tried to edit it. Then I had a professional editor, and I spent a lot of money on it. And I printed it. I guess for me, a lot of money was probably like, $500 to edit the thing. And I used this whole thing, like 5 mistakes you shouldn't make when you have diabetes, 5 ways to prevent a foot wound, the 8 steps in the comprehensive diabetic foot exam. I got this from a person talking about like diabetes, and I still have that to this day. And it was nice, and I printed it, but I never really used it. So one thing for you guys, if you're listening, if you're thinking about making content, use the darn stuff. A lot of times we make and we just make and we just make and we just make, but it should be evergreen. You should continue to use it in like as many different ways as you can, okay? And so I made all these things, and I just kind of never used them. And then I decided I'm going to start making books, and I made tons of books, and I was trying to do one book every quarter. I was copying this guy named Dan Sullivan, who made a book a quarter, and I'm going to write a book a quarter. And well, after I did like 5, I got tired of it, and that was enough because I wasn't really excited about the other things. And then I started to make like videos, and I liked videos more, and that's where we get today. And I put the book and the videos together, and I called them courses. So where we're at today is patient education information. We're using this thing called Patient Education Genius. Okay, I don't hand things out to people anymore. I just do this. I do it for twofold. The one of the reasons is I can give out information. So in there you can upload PDFs, you can upload videos, you can upload audios, you can upload as much junk as you want. Now, don't make the mistake that I did. Patients came in and I gave them 50 things. If you give patients 50 things, how many are they going to do? They're going to do exactly none. Okay, so you don't give them 50 things. I made this mistake. I'm thinking that's all that people want to learn about is their plantar fasciitis, and they're going to listen to everything that I say. They're not. Okay, give them 1 thing or 2 things, and have them look at those things. Okay, if they're interested, they're gonna learn more. Okay, they're gonna search out more, and you can give them more information. And so that's what I've kind of done now. Is when patients come in, I will send them 1 link to the plantar fasciitis course, and that's going to go back to my Kajabi site. And on that course, it has a book download that adds them to my list, and then I have some videos, and that's it. And I have a quick start guide on the top, and that's it. And then I kind of go through and I kind of teach them what they're going to be doing to get better and kind of what's next and things like that. But I have a lot of other information. And the neat thing with Patient Education Genius is on the lateral side or on the outside of the page, the left side, you can make different folders. So I would recommend that every folder in it's an alphabetical order. You would put all the diagnoses that you treat. So when a patient comes in, you pull up that diagnosis, you click what information you want to send them, and you send it to them. So it works really easy. You can put anything that you want in there that might be interesting. You can take a picture of it. You can send them a website, anything like that. Now, a few other things that are neat about Patient Education Genius. With this, it connects to most medical records. So Cerner, Epic, Athena. And so when a patient comes in and you click this little icon, it'll open up Patient Education Genius, and it already pulls in their email and their cell phone number if they have one. So that way you can either text it or email that information, or both. You can send it to the patient that way, and any other types of patients that you want. So that's a cool function that I like. Makes it really easy. And then it also documents it that you gave it to them in their chart. So if they lose it or they don't get it, you can go back there and see what links you sent them. So that's a cool option. And then also within the Patient Education Genius, when they get that text message or email, it'll have the content, your little picture, the content, and then some calls to action underneath it. So if you want to advertise your books or advertise your videos or advertise anything else, that's a cool aspect. Okay, however you want to use that. And then the next thing, which I think is really cool, I think everything is cool, but it has this little chat bot that comes up. It's a little chat bot, and it says, "Hey, how do we do?" And if you say good, it'll say, "Would you mind doing a review?" And it'll automatically send them to your Google review account. Now that's cool. So everyone you're sending patient education information to is getting this review request. So that is a very interesting thing with Patient Education Genius. If you guys want all of my folders and kind of what's in my folders, I'd be happy to do that. So if you sign up with them, just say, hey, give me Dr. Pelto's information. They'll reach out to me, and I can transfer those over. And also, if there's a search function, so it has everything that there from like ACFAS and things like that, foot health facts and things. But it's good to make your own videos, I think, because patients like that better. So that's how you use Patient Education Genius. It's pretty reasonable. I think it's a monthly charge per doctor, but it certainly is well worth it, even for getting those reviews, because those reviews are golden. So that's what it's called. It's called Patient Education Genius, and that's my deep dive. Hope you guys enjoy it.